Hi everyone, Melissa Milliken here, coming to you from Wickiup, Arizona in the highland deserts. And I live on a homestead here. I work full-time as faculty at Grand Canyon University, but I wanted to come to you just kind of informally and offer some insights into some professional counseling issues, especially those dealing with clients with addictions. And so, I put off doing these for a long time because I thought after work, so a lot of times I'm just kind of tired and I don't want to get all spiffied back up. So you guys are going to get the info with me as I am. And keep in mind, there's a lot going on here, so I'm not going to always look super pretty. But I'm going to bring you the info, and that's really the main thing that I want to do. Okay, so here we go. In addiction counseling, we have a lot of different evidence-based approaches, right? One of the most commonly used approaches is 12-step facilitation. And there are, the majority of organizations that treat substance use disorders and even other addictions like process or behavioral addictions use 12-step facilitation to some degree or another. The problem is there's just not a lot of adherence to the actual interventions that go along with 12-step facilitation. Let's back up just a minute. 12-step facilitation is a clinical counseling approach. And remember, if you're a counselor, of any type, you should be working within your scope of competency, scope of practice. That's a legal and ethical issue. But let's talk specifically about mental health counselors who are able to work with those with addictions. Mental health counselors follow the ACA Code of Ethics, and those say that we use empirically based or evidence-based approaches. So the problem is most people don't. I found some literature that says maybe 25% of counselors are actually using evidence-based approaches. Sorry, my water pump is going off right now, so I hope it's not too loud. Not going off, it's on. You know what I mean. So basically what the problem is that a lot of people are providing addictions counseling without actually following the interventions that go along with their 12-step facilitation approach. Keep in mind, most organizations use a variety of approaches, not just the 12-step facilitation approach. So you may be at a facility that uses, let me just give you an example. I used to work at a substance use disorder facility that used sort of a tripod approach. It was motivational interviewing, solution-focused counseling, and 12-step facilitation. So we used those interventions, those strategies from those approaches. Remember, the approaches like CBT, SFT, which is solution focused, have all those interventions or strategies under their umbrella. So we would use primarily those interventions from those three counseling approaches, which have been evidence-based or proven to work. So then you also need to consider what your own personal theoretical foundation is. So if you are a Gestalt or Adlerian as a personal counselor, you may also draw in some of those approaches. Now, you may find a client who comes to you and says, hey, I've had counseling in the past and I really loved the existential approach, or maybe a REBT approach. And so they may actually specifically request a different approach. Now, it's our ethical obligation to remain true to what we know and who. Sorry about that. Husband called and the video shuts off when that happens. So, all right. So we have to remain true to who we are and use all of those different approaches ethically. What does it mean to use them ethically? Well, we have to know what they are. So we don't just say we're going to use this intervention without really understanding how to use it. So we've read our textbooks, we've read our hopefully literature that you've looked up that's scholarly and peer reviewed. You have perhaps, if you are, for example, a CBT counselor, that's your theoretical orientation, that's the approach you have chosen. Hopefully you have a CBT book, meaning a book just specifically on that approach. So what it means to use those ethically is, well, you integrate them as appropriate, as needed, as it flows in treatment. And you also use what you know. Okay, seems obvious, but honestly, a lot of counselors aren't doing that today. They're just kind of winging it. Now, person-centered counseling is often used, and that's how counselors can say, well, we're doing more of this talk therapy, and I'm just being, congruent and empathetic, and all the main tenets of person-centered counseling. But we really need to go a step further than that and provide clinical skills, because let's differentiate mental health counselors who are professionals from other helpers. So we want to use clinical interventions, and we are the experts in our field. So just make sure that you know what you're doing, be the expert in your field, and do not just wing it. And do not just, bring it forth in a new or different way just because you feel like it might be worth the experiment, because ethically, we are not to use approaches that are experimental. Unless, of course, we have brought that to the client's attention and we are going to include it in the informed consent and speak with them about that at the beginning of counseling and perhaps throughout. All right, so back to 12-step facilitation and what that looks like. So a lot of organizations say, well, we're 12-step facilitation because we take our clients to AA meetings or NA meetings, or we bring the meetings in. So we bring in members of the 12-step community into our agency, and they have meetings here. So therefore, we're a 12-step facilitation agency. Or it may just be that they encourage their clients to attend meetings, especially in the case of outpatient clients. They encourage them, and they also give them a meeting list. So a lot of individuals are saying that they use the approach because they do those things. So that's on the very end of the spectrum. On the other end of the spectrum, folks are using that 12-step facilitation therapy manual, which was published in 1999. And it was at that point, it was considered 12-step facilitation was considered an evidence-based approach. And it outlines how it should be used with clients. That's in the individual and the group settings. So beyond that, because that is obviously a little outdated, 1999, some things stay consistent over time, but there have been some changes in the world, our culture, use patterns and things like that. And so I do encourage everyone to purchase Dr. Joseph Nowinski's 12-step facilitation handbook. And you need to just know what those themes are. You really need to know what the expectations are for starting a session and ending a session. You need to know what sort of homework assignments to send home with the clients. And beyond all of that, understanding 12-step facilitation itself, you need to know how to and when to and why to incorporate those other interventions or strategies from the other evidence-based approaches that you may be using, such as CBT, solution focus, motivational interviewing. And I think that is where we are falling short. And so what I propose is a 12-step integration approach, which is just that. TSF, okay, I'm going to start using TSF as the word because 12-step facilitation is a bit of a mouthful. So TSF integrated with those other approaches you are both required to use at your agency and those that you use as a personal counselor, as well as those interventions that you might pull from even other evidence-based approaches, excuse me, as appropriate as your client requests or perhaps as you see fit. Perhaps your supervisor and you, or in a staffing with other multi-disciplinarian professionals that are in or involved with your agency. Maybe you've staffed it and someone is like, hey, I tried this approach with a client the other day and it worked really well. And you're thinking to yourself, I've never done that one. It doesn't even fall under any of these approaches that I typically use. So then you research those approaches, or that approach, rather intervention under the approach, and implement it once you know how it should be implemented. Okay, so make sure, please, that you are reading, listening, watching, learning about the approaches. So a lot of counselors, especially those that have been in the field already, not perhaps in the capacity as a mental health professional, but maybe as a substance abuse counselor. And those have different credentials, different ethical guidelines, and different scope of practice or competencies. So they sort of think, hey, I've been doing this for a while. I know what works. I'm just going to keep on doing what I've been doing. And that's fine to some extent because they know who they are and what they're comfortable with as counselors. But as clinical mental health counselors, we want to be providing professional and clinical services and interventions. So now that we've got that out of the way, I'm going to come to you again another time, and I'm going to really lay out more specifics about 12-step facilitation, obviously citing Dr. Joseph Nowinski, as he is sort of the guy that was with Project Match, which was the foundation for that 12-step facilitation therapy manual that I talked about, published in 1999, pronouncing TSF as a evidence-based approach. So he was a part of that. And then he is also the one who has been providing information and even courses through Hazelden University, I believe it's called. And so he is sort of the expert on this. So I will be citing his work quite a bit because this is not my own information. However, there are a lot of resources out there that you can find that talk about 12-step facilitation. But I warn you, I ask you to please keep in mind that some of that information is wrong. And this is where my passion comes into play. What I have found is that 12-step meetings, those non-clinical, run by volunteers who are also in recovery themselves type meetings, those AA meetings, are not clinical. So what we find is that a lot of individuals who are in the field, whether it be psychiatry, psychology, social work, or just researchers, maybe they are counselors, they have a misunderstanding because they haven't done the research. They haven't become a professional, an expert in 12-step facilitation, and they don't understand that it is not faith-based. Now, faith-based means it's based on a particular faith or even a few different faiths, perhaps Christianity. Now, we're going to go into this a little bit deeper, and I know I'm going to spark some debate here, but I do not believe personally, from what I know, that 12-step meetings are faith-based. I will say spirituality is highly suggested. In other words, finding a higher power. However, a higher power can be anything greater, better, more powerful than oneself. Therefore, they get out of themselves, they seek help, and they accept help, and they can then change, sort of like inertia, right? If you've got something going in a straight line, It takes something else to sort of come along and bump it into another direction. And without that level of surrender and acceptance and humility, a lot of individuals don't find their path. They also will not oftentimes even go to meetings because their client or their counselors are telling them that these AA meetings or NA meetings or GA meetings or whatever kind of 12-step meetings are faith-based. And so a lot of individuals who are either atheist, agnostic, maybe of a different religion, hear that it may have had some Christian underlying values, and they will not go, thereby not finding recovery, not finding a recovery community, their new people, their new safe place, a way to get out of themselves, a place to do service work, and then finding long-term sobriety or clean time and becoming productive members of society. I find that as a problem. So what I want to encourage people to do is go to the AA website because, well, AA was the first 12-step program. From there, all the other 12-step programs came into existence, such as CA, MA, NA, and all of the others. I want you to go to the AA.org site and just search some of their literature about is AA religious based. You'll find straight from the horse's mouth, so to speak, AA is not intended to be religious at all. Now, if you have one individual who is in recovery and goes to AA meetings and is very spiritual or I should say very religious, you may hear them talk about their God, their religion. That doesn't mean that AA itself is religion based. And so you will see very clearly all throughout the AA literature, spirituality is suggested, but it is not required. It says it in the literature. It has since the 1930s. Nothing has changed. However, some folks and some researchers have put wrong information out there, and it has kind of snowballed. And so a lot of clinicians and researchers now believe that it is faith-based while it is not. By the way, from my understanding, the Department of Defense and prisons are no longer allowed to recommend clients go to AA meetings and other 12-step meetings because they read incorrectly that those programs are faith-based, and so the separation dilemma comes into play. I think this does an injustice to our clients and our communities, and so I'm really just passionate about getting the correct information out there. Now, if you disagree with me, that's perfectly fine. However, I still want you to go to AA.org and look at their literature and understand that from their perspective, from the overall broad perspective, AA is not to be religious at all. And I will say, too, that the Alcoholics Anonymous big book, the main book that they read from, has one chapter, specifically for the agnostic and the atheist. And so it tells them exactly how to be good members of 12-step meetings while not believing in a deity. So their higher power may be a sponsor. Now we can get into that later as well. A sponsor, a group, the folks that they go to their meetings with. It may be their counselor in some cases. It may be a group of people, some healthy folks that they know, or family members, somebody that they trust, that they can seek good information from and advice from, and they're willing to take it. So they're getting out of themselves. I give the example, it's sort of like if you break your ankle, what are you going to do? Most likely you would go to a doctor. That doctor has greater or higher power. It doesn't mean they're a deity, but you trust them, you seek advice from them, and you take it. And so that's what we're talking about here. We're talking about people in recovery who go to AA meetings or the like and ask for help and humbly want help. So if a person is very religious and they go to a meeting, they can absolutely incorporate that into their recovery, but they absolutely do not have to have any religion, nor do they have to adopt any religion. So I want to make that real clear. At the same time, Celebrate Recovery, for example, is Christ-based, and there are other religions that have their own 12-step meetings. So if an individual is very devout in their religion, they may seek out one of those specifically. But in general, 12-step meetings are not religious. And so I want to get back to what the foundational interventions are for 12-step facilitation and talk about how to integrate those with those other interventions from other evidence-based approaches to provide 12-step integration in an ethical and effective manner in future videos. So that is the beginning. Now keep in mind, if you find that I talk a little slow, maybe you're on the road, don't worry about looking at me, just worry about listening, okay? So if you want to put me on 1.5 speed or 1.25 speed, whatever it is, to get you this information, feel free. That's the way I listen to most videos and podcasts. It's just a little faster than they normally talk. And I also encourage you, like I said, to go to aa.org. So I guess like and subscribe, and hopefully I'll have several more of these videos. Hopefully I'll be able to address some comments, questions, or concerns along the way. And I look forward to many more videos and sharing some of my perspectives, both personal and professional. Thanks, guys. See you next time.